news. So, what is SPRAVATO? SPRAVATO is intranasal esketamine. It's a non-daily FDA-approved medication for depression. It's different from traditional medicines in several important ways that we'll talk about. The first is obvious to anyone who sees it. It's not a pill, it's a nasal spray. SPRAVATO goes into the nose and it's absorbed directly into the bloodstream from there through the rich network of blood vessels that exist in the nasal mucosa. How does SPRAVATO help depression? SPRAVATO targets a completely unique receptor in the brain. It's called the NMDA receptor. It's located on brain cells, which normally inhibit another pathway called the glutamate system. Increased glutamate signaling has an overall activating effect on the brain's mood centers, and like TMS, leads to a measurable increase in neuroplasticity. That's the brain's ability to create new proteins, cells, and synaptic connections. We're still studying exactly how that process happens, not just in the case of SPRAVATO, but because it's important, and may be a key step to improving other conditions like dementia. How is SPRAVATO dosed? I think we have a slide on that. So SPRAVATO has two available dosages, 56 milligrams and 84 milligrams. In my clinic, we typically start with the lowest dose, at least for the first treatment. We can always go up if you tolerate it well. Another key difference between SPRAVATO and traditional medications is how often you take the medicine. I said it earlier, SPRAVATO is a non-daily treatment. We start with what's called the induction phase. That's 2 treatments per week for 4 weeks, 8 treatments total. The purpose of this phase is to give the medicine time to work and for you to see what you think of it. If it's not for you or it's not helpful, we'll of course talk about other options. However, if you are in the majority and it is helpful, we can move forward to what's called the maintenance phase. Here we treat less frequently, just once per week or once every 2 weeks with the purpose of maintaining that good response. These numbers are from a single study that you see on the screen now. Obviously, these are promising. I would say, however, that a good average of many studies puts the response rate of SPRAVATO at something like 50 to 70%. Remission rate, or the percentage of patients who after treatment have minimal or no symptoms, is effectively a little bit lower than that, about 30 to 50%. But the headline is a similar one to TMS. Most patients benefit. Another key difference between SPRAVATO and traditional medications is when you might see results. Results are expected by the end of that 4-week induction phase. That's compared to 6 to 8 weeks, which is classic for traditional medications. Something else we see across multiple studies, and certainly anecdotally here in our clinic, is that a subset of patients report benefit in as little as 24 to 48 hours.